everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we're coming here with someone brand new specialty, and most importantly, a new perspective, something that we haven't learned before. And so today I have a really awesome special guest for you. I'm very excited to talk to you, Dr. Victor Garcia. He is the co-founder and director of operations of Bridge Physical Therapy and Performance in Miami, Florida. Welcome, Victor.
Thank you for having me on. Excited to discuss some things about this.
Yeah, I know. We have a lot to dive into, but I kind of love to structure things with kind of getting to know you first. I think everyone's kind of interested in, maybe what inspired you to open your own, private practice. What's your journey that got you here?
I guess private practice was first. I was always wanting to I was kind of pushed family wise into medicine, and then along the way kind of figured out physical therapy, but I was pre-med originally because of that, and then decided I wanted to open my own practice regardless of the setting I did. I leaned towards orthopedic surgery and then ended up with physical therapy. So with that, I just kind of knew I wanted to do private practice. And then when I decided on physical therapy, I was like, well, I can still do it there. Still medical related, kind of with the same like athletes that I wanted to work with. And so I just kind of continued it.
I love that. So primarily working with athletes, is that, the goal of Bridge Physical Therapy? Are you serving high performing athletes? Are you still kind of diving into that realm?
Yeah, we definitely see majority athletes. The way we kind of say it is everyone is an athlete, so it's more of an active population. But because of that, yeah, we do see a lot of active athletes in terms of like currently playing sports at a high level, whether it's high school, college, or professional. But for the most part, we'll see. I mean, call it your retired athlete or people that are like the weekend warrior or whatever they like to describe themselves as. So we'll just see anyone who's active and has active goals. That's who we work with. A lot of those tend to be higher level though.
That's awesome. So, out of the athletes that you see and the folks that you see within the office, what would you say are the most common areas of where these high performing athletes are struggling? What are, the common things, but I'd also love to know what are some of the uncommon things that you help people with? Because I think there's always so much more that meets the eye. To what people do, especially when you're serving athletes, people may not realize the full extent of how and which you can help someone.
Yeah, for sure. So common because we work or opened up in a where there's like batting cages for baseball players. And my business partner is a pitching coach. We do see a lot of baseball. So super common is arm care stuff and a lot of misconceptions there, and stuff that we help with and try to make sure everyone's kind of going the right direction is the things that actually hurt their arm and the progression to get back to throwing at full speed, like 100% capacity. And so a lot of people will then do like a physical therapy treatment at a clinic who doesn't work with a lot of those athletes. And so, yes, they'll be pain free with everything. And then they go back to try throwing, and it's like, well, I still have pain with this. And it's just because there's a big gap from the things we do in our day to day life to throwing a baseball 90 miles an hour. So they're not really done with the rehab. So we see a lot of that stuff. Uncommonly, we see because of the way that we structure our one on one care. Um, so we have a lot of time with clients and we've had a good relationship with a lot of providers in the area. So we do get a couple hard cases that are completely unrelated to the fact they're an athlete or not. Like actually recently we had an unstable, I'm not going to answer technical, but the vertebrae. So he had an unstable instability in the spine there in his low back, but he kept on getting diagnoses of like where he may need some sort of nerve stuff that was going on. It could be a disc. I think he had a discectomy about a year ago. Turns out just a really weird case. I didn't see him, so I'm like trying not to speak on too much of the specifics. It was one of our providers. But we'll get cases like that they've been through a lot of rehab processes, seen surgeons, physicians, physical therapists, had surgeries, and they kind of end up in our doors. And even if we don't treat them, we kind of send them in the right direction. And this is one that is seeing another physician who specializes in this. Very uncommon, but things that we'll get.
That's crazy. I feel like, so many people go through the gamut and finding, I would say, their person to treat them, so many times. How often do you see people where they're like, yeah, I've seen like five different specialists and I'm hoping you can solve my problem?
Yeah, yeah, a lot. And it's unfortunate, but it is true.
Yeah, it's insane. And in terms of, what you're doing with arm strengthening and pitching. I love to learn, a little bit more about that and kind of your approach, working with, these baseball players. What do you think is causing, a lot of their discomfort, or is it just overuse? Are they doing something strange in their pitch that causes other things? So are you working on speed, but also working on maybe some of that tenderness that they're feeling?
So I'm not just
Mhm.
because I work with such good people in my industry or in our facility, I would definitely be like, oh, Q and Alec right now to discuss this. But I mean, yes, I can speak on it loosely, and I'm going to try not to get too crazy specific just in case. So when it comes to with these baseball players and throwing specifically, a lot of the misconceptions that we hear is related to the types of pitches. So let's say they're throwing curveballs, and that's a big one where it's like, oh, because of the arm action that stresses this area of the arm. It's actually speed is so much more stressful than the actual type of pitch. So even we see a lot of younger kids who get bone injuries that get misdiagnosed as like strains and things.
Mm,
It's really just a product of volume and the amount of stress. Stress is going to be more related to speed and even how big the kid is. If they're going through a growth spurt right now, where
mm,
those growth plates are like really fragile and they're expanding, um, with the older kids, we'll see a lot of like, yes, it's still speed, but it's actually when we're talking mechanics, it's more the legs and being able to use their lower half that efficiently. Because the less they can do there, the less rotation they can get out of their legs, the more their upper body has to do. And then if they're throwing at a really high speed and their arm is going through the added stress that the legs aren't taking over for, or I guess removing from the upper half, um, now those two things add in volume throughout an entire season, it starts to stack up and then it starts to get pain.
absolutely.
Um, One of the things that we focus on most is the ramp up process. So with every sport, the most likely time to get hurt is at the beginning of the season. And a lot of it is a product of just like you went from 0 to 100 really quickly. And there
Yep.
has to be a very smooth transition. So early season, we see a lot more of these aches and pains and injuries coming about. I mean, ACL tears are common. I mean, we see a lot of that, obviously not in baseball players, but just in general. So I have a few that are coming in now for ACLs. We do see these arm pains, shoulders, elbows with the baseball players as they're getting into fall ball. So we have these conversations in terms of ramp ups. And when they are in pain, it's like, well, we have to do what we were supposed to do previously. And so a lot of our rehab process just kind of looks like a light pitching lesson or a light bullpen because we'll have them throw different weights. I don't want to get too specific, but um,
Yeah.
light balls move faster. So those are more stressful for a ligament, being the UCL. Heavy balls move slower. Those are going to be a little more stressful for the bone just because it's not as fast, as stressful on the ligament. So depending on if they have a bone injury or a ligament injury like a UCL, we'll start to play with those weights and play with the speeds, play with the volume, and slowly move them back up to their full capacity. And
I
that's my short soapbox on how we work on baseball players.
No, that's awesome. There's so many things that I think, calling out like the parents out there, right? Getting your kid in before, a brick comes through the window and now you're in this injury. Like, let's start this early, before you get into season, like you said, before you go 0 to 100 and before you start getting injured. And, let's catch some things early. Let's see where we're at. But then also how you blend physical therapy and then also having someone that is really trained to work with high performing baseball players that and melding that to make someone feel better, do better in their sport. I think that's really unique and different. But also speaking about your approach, do you have any other modalities that you're using in the office that's interesting, that aids in recovery, whether it's for your physical therapy patients or for your athletes or your baseball players?
I was going to mention on the last thing you meant before I get into modalities. That's actually where the name Bridge came from. And it wasn't, we weren't seeing baseball players yet. It was where we're seeing people who, and not to talk badly on physical therapy, but there is a certain expectation or capacity. Like even when you take the insurance, like they're here to cover medical necessity. And throwing a baseball really quickly is not. And a lot of other things that we treat, like getting back to playing pickleball, maybe in the short term, you can kind of, there's some modalities that are getting in the way too with this injury, or not
Sure.
modalities, ADLs.
Hmm.
But eventually, there's more that they need to do strengthening wise to get to where they need to. And we do a lot of strengthening, especially for the arms, the legs, all these things. Um, but that's where the name came from for these athletes, where it's like they may have tried physical therapy, they are pain free. So we're bridging the gap from like where you want to get to and where you currently are, even if yes, you're pain free with everything you have, it's just not the activity that you wanted and may not be viewed as medically necessary to live. And then going back into your now question, the modalities. So not considered a modality, but something that I can't just ignore is our strength testing.
Mhm.
So we're really big on objective measures. And so from day one, we're immediately trying to get real numbers as opposed to in physical therapy, we use what's called manual muscle testing, which
Mhm.
is like just push into me and then I'll grade you based on not just overall like one side to the other, but also what I think is appropriate for this based on my experience and my feel. But
Mhm.
everyone's feel is different, especially, for example, me and someone who maybe works with geriatrics, what they may call a five, which is the best, is different from what I call a five. Because I'm used to working with a younger, healthy, very strong, let's say, shoulder for a baseball player versus in geriatrics, like that's not what we expect out of them. So their five
Right.
is very different from my five, just on the therapist end, obviously on the client end. Um, which is fine, right? What each goal is different.
Sure.
But what we try to do is make it where we know, okay, based on where you're at and your goals, these are the numbers, the actual numbers, not just my feel that you should be hitting. So we're really big on strength testing, even getting them in the right position, making sure that each therapist is doing it the exact same way, because that can skew the numbers also, like more advantageous positions versus less advantageous positions to test in, making sure they're not compensating, moving. So we set them up really specifically in how we strength test for whatever joint that we deem is needed to strength test based on their goals, their activity, their injury.
Mhm.
Um, so not really a modality, but like our step one. I think the modality we use the most is blood flow restriction. Use
Mhm.
that a bunch, like almost, I would say about 70 or 80% of our clients are getting it at the end of their session for different uses. And I can explain that one if you need me to. But I was also going to say dry needling we use a lot too.
Nice.
Um, but it's very client dependent, especially on the dry needling. We don't push a lot of or automatically assume the use of like soft tissue mobilizations, things like that. Like I think our perspective on some of these modalities would be more of when you're in extreme pain and needing to get out of that pain and get back to movement, we can use that. But with our patient population, they're ready to move to that next step already and get through strengthening, get through their mobility stuff, really start to push the limit. And so we don't use a lot of the more passive modalities, things like that. I
Yeah.
mean, someone tears their ACL, we're using eStim a lot too. Like we have our NMAS units. But outside of that, I would say those are probably our biggest modalities. I mean, we have cupping for recovery stuff, but
Sure.
nothing outside of those that are like kind of automatic because that's just what we like to do.
Yeah.
We prioritize like what they need, I think, sometimes to a fault. Like we want to include their perspective and what they want to.
Yeah.
But we're automatically going like, this is what you need. Like we think this is going to be the best for you, and then kind of cue you in. Like, okay, what are the things that you're expecting though? Like, what do you want? And then we'll add in the other stuff.
It seems like your patients are really motivated. As athletes,
Yeah.
they're like, just from the way that you're talking, they're ready to go. Do you feel like you've ever had to be like, okay, we need to like pump the brakes? Like I know you're excited for this, but like not yet?
Yeah, you're right. They definitely are, and that does become a problem, but it's a good problem. Like it's
Yeah.
very hard to get someone, especially with an injury. Nobody wants one. So like our one of our core values is make it fun, and we try to make it more of like a locker room experience where I mean people have great memories of like their team activities that they did and like joking around and stuff like that with or even with the athletic trainers back when they're high school, college. We try to
Sure.
have that same sport active fun experience inside of a clinic because at the end of the day you don't want to be in rehab or physical therapy. Like that means you're removed from your sport, you're hurt. So yes, they do come in very motivated, ready to get back to sport. And then oftentimes it feels really good. And they're like, okay, let's keep going. It's like, no, there's a time component to this too,
Mhm.
because we're going to find ourselves in a bad spot and go backwards and extend this rehab process unnecessarily. And at the end of the day, we are, because we're pushing kind of limits in terms of what their body can adapt to and how quickly it can recover, we are kind of guessing in a sense just based on what we know is a normal recovery time frame and kind of just staying right below that limit and just following along as that time train is chugging along. We're just staying right behind it. And we may be a little further than we think because we can't see that train. We don't really know what the real timeline is for this specific person, but
Yeah.
we can guess it pretty well. And the minute we get a hiccup, we're like, no, that's it. We're done. We're dialing back.
No, it
We get
makes
a lot quicker. Yeah, results they go by a lot faster with that.
Yeah, it makes a lot of sense. And I like how you're quantifying your data, seeing, if you're having an older person come in and they're not maybe the youngster that is, actively training in baseball, but their goals are very different, and how you scale them in your muscle testing and all that, and grading them, the 1 through 5, and how that might look very different for your athletes, because what they're capable of, especially if you've seen them before and you're like, I know what this kid can do. Um, this is the grade now, and this is where we want to get to. So that makes a lot of sense. And that it's
We're
not just
actually
one size
on
fits all.
the Yeah, 100%. On the note of because I meant to mention, you mentioned like how we're quantifying data. So
Yeah,
we're actually in the middle of building a database because it's true. Like you can't measure or compare someone who's 18 and playing X sport to someone who's 65 and
yeah,
wants to do this activity, right? Whatever it is their goal is. So we're actually making a database that kind of filters down by age, sex, and sport. Oh, and then even skill level with the sport. Because like let's say someone is playing tennis, but you can have pro tennis and retired tennis, right? And so I shouldn't be comparing the expectation there because there's a natural, like, okay, you're in your prime years versus not. And
sure.
so we don't want to make someone feel bad unnecessarily or take a professional player and say, oh, you're way too good already. Like, we don't have to work with you.
Yeah.
The competition is different. So we're making a database right now that takes like our normative data of the people in our clinic with all those like very specific tests to give real true norms and goals and expectations rather than just push into me that feels strong, cool. It's going to be very down to the decimal. Like if they push 150.2 pounds, like we'll know that. So yeah, that database is a big project that we're working on now.
That's awesome, because I feel like, there are averages in healthcare, and I don't think that's maybe so true in, I think other forms of specialties, specifically to what you're talking about. Maybe if your cholesterol's high, your cholesterol's high. But in this situation, I think it is so different. And so I'd love to even like ask you, I know you've kind of debunked a few already for us, but I
Mhm.
do feel like there is misconceptions within every specialty, every field. Are there things that people come and commonly ask you, like when they step into the office, like, oh, like I heard this, or this, and my friend went through that, and I don't want to do that. Are you going to do this to me? Um, what are some of those things that you feel like are totally outdated, old wives' tales, whatever it might be, about whether it's physical therapy or even about some of the pitching stuff that you guys are doing?
The first one that came to mind as you were asking the question was about lifting weights and
Mhm.
safety and injury with that whole thing.
Yeah.
Because we often see a younger population. I mean, as young as like 7 or 8 for physical therapy because of all these bone pains. I mean, in the heel, the elbow, depending on what's going on or what sport they play, shin splints. So we'll have these conversations about, and not because we're rehabbing bone, but just in general about lifting weights. Is that okay for them? Stunting growth, all these things. Um, we don't really have any evidence to prove that it's true or false. More so, we'd lean towards the fact that it's false with the evidence that we do have. So we are encouraging that and kind of showing parents like it's okay to do this at a young age. And even there are studies showing how like the bone development, you're giving the body a reason to lay down good, solid new bone, especially as they're going through these growth spurts. And that might even, not that I'm saying it does, but there's the same way that it may stunt your growth, that might actually lend to increasing your growth, right? Like it's very 50-50. And so we know it'll make you stronger. We know it can help reduce your risk of injury, even just teach you how to move like mechanically, like neuromuscular control. So with all the pros there are, we feel that outweighs. And so we have the conversation a lot. The other one that I was going to mention that initially was something on my mind to talk about because we have this conversation all the time with the parents is what these bone injuries are and if they should or shouldn't be playing through them. Um, the first thing I tell parents when they come in the door, when it comes to their child and a bone injury, is that I'm not going to fix this because the reality of it is they need time and rest and the
Yeah,
body needs to take its course. So
makes
we don't like
sense.
to, we're not trying to sell like, oh yeah, I have the perfect plan of how to rehab this whole thing and get him back to or her back to 100%. And without me, you can't get there. At the end of the day, they can just solely go home, which is what often they get prescribed from the physician is rest for 6 weeks and then go back. The real conversation and one we should be having is not whether or not the resting is right or wrong, because it's absolutely right. It's actually on the back ends where it's like that ramp up that we talked about earlier. where it's
Yeah.
like, yeah, you can rest for a long time and the pain will absolutely go away. Your body will be in a better place, but you're also deconditioned. Your body is now less adapt for the stress that you were originally doing and you want to continue to do again. We have to ramp you back up appropriately and make sure your body's ready for it. And
Mhm.
so the rehab really comes on the back end. And so it's something that parents aren't really expecting. They're like, okay, cool, let's just address this right now. It's like it needs time. And if that means I'll see you in 3 weeks, so be it. We like to manage the rehab process as opposed to dictate it. The body kind of dictates, and we just kind of make sure that we're doing what needs to be done to make sure we're putting that body in the best position to thrive. So that way that athlete can enjoy whatever activity they want to do. And when I say athlete, again, all ages.
Yeah,
Um, but
absolutely.
that is specific more to bone, so the younger kids.
Yeah, I feel like no one talks about that. I feel like, yeah, oftentimes you get your x-ray or whatever happens, rest for 6 weeks. But then no
Yeah,
one talks about the re-injury that happens afterwards because you're putting the same, if not more, stress on that same area when you're going right back to it, thinking that you can do the same thing. Right
100%.
after. So it totally makes sense. I think people just need to hear it. You know,
Hmm.
I think people just
I
are not
agree.
told that. I think people just need to hear that. And I was totally going to ask you about, about the whole stunting your growth thing with weights because I've heard that, so many times.
For
Oh,
sure.
I think it's total like old wives' tale. I'm like this feels like a good thing for your body, but I don't know. And I think people, again, we just hear things and we think it's truth after a while.
And to play also the other side of the equation too, it doesn't mean that we should be, having our young ones like max out every day, right? Like it doesn't mean to. You can definitely get hurt lifting anything, lifting a weight. But the biggest reason people get hurt with lifting, let's say a heavy box or something, isn't the mechanics, which is another misconception. It's more around your capacity to do it. So like my one of my coworkers has had a client for a long time. And I have one that's 74, but this one specifically that I'm thinking about, she
Hmm.
is 66, I believe. And part of her routine every time she comes in, I see her doing it every time, is she's picking up pretty heavy kettlebells, like 235s,
Yeah.
with the worst form you can imagine, where anybody walks in and just be like, why isn't he correcting her? It's like, that's literally the way he's asking her to do it. That way her body is super strong, super resilient, because it's less about the position you're in and more about can your body tolerate that position. And so if you just continue to do things really wrong, quote unquote, with a gradually and progressive heavier weight, then eventually your body can tolerate so many positions. And so we just got to get people strong in every position. And so now she doesn't have to worry about what life throws at her and what she has to pick up when, there's no one there to help her. And as she gets older, that may happen more often where it just feels too heavy or too awkward or bulky. Now she's just resilient and independent.
I love that because there are different things that you're doing in daily life that
Mm-hmm.
you're not in perfect form doing it because things are awkward but that's also life. And
Yeah.
so can I want you to do things the right way, but let's get you ready for when that shift may happen and you're not ready for it, but now you could be because we practiced it and so we're here
Mm-hmm.
now. So that makes a lot of sense. I think a lot of what you're doing applies to real life, but it's also very sensible. It just makes sense. I just don't think people have heard what you're saying in this kind of way. I think people are just told to do one thing and they're like, oh yeah, let's, like I said, rest for 6 weeks, then let's go back. There's the ramp up period that needs to happen. So I like a lot what you're doing, but to kind of round out today, I'd love you've given us so much to think about, and especially for parents, other athletes. Is there other maybe tips or advice that you can give to your clients, whether it's your physical therapy, pitching clients, baseball folks? But then this is kind of an interesting two-pronged question. I feel like there's also a lot of great people that may have also just started, their practice. Maybe there's veterans, people here that are listening that have had their business for 25 years. I always think there's something to learn. Is there something a pro tip that you can give to other practitioners that you couldn't live without every day doing what you're doing in the office, whether it's a piece of technology, something, maybe it's your database. You're like, I'm really pumped about my database. Everybody should have this database.
I
um,
do believe that.
yeah. So I'd love the two-pronged question of pro tips. One for your clients, but then also for practitioners, maybe something that they can learn along the way too, and maybe something that they can think about that you want to leave us with.
For everybody, for both sides of the equation. I think everyone should be more of a skeptic. I think there's way too much information out there to not question things. Even yesterday, I had a 13-year-old that he's hilarious. He's joking all the time. And he was talking about, I mean, I don't know confirmed if this is true or false. I think it's false because I did a quick search. On TikTok, he saw how kids were getting abducted by ice cream trucks. And the dad was like, I haven't heard anything in Virginia. And then quickly Googled, and all the articles are like that the local sheriff community, whatever, is like, no, we're not. That's not the case. But it's just there's so much information overload for everybody, whether it's people looking as clinicians to get better at their craft, to open businesses, uncertain clients, patients, parents that are trying to figure out what do we have to do next with this injury, the whole like Google or WebMD type of thing. There's a lot of information out there, and I think we should just always question a little bit more. I guess honing down into practitioners or maybe even on the business side of things, I think I would say the only entrepreneurs that fail are the ones that quit. Because as an entrepreneur, you're never going to have a smooth and steady ride. It's just being able to pivot and adapt. And if you didn't quit, you probably had to pivot and adopt a lot of times. And so I think it comes down to just not giving up. And if you know for sure that you have something that can help people, if you can help one person, there's probably a lot of other people like that that need that help. If you have a product or service, an ability to do something, it's on you to figure out how you can provide that to everybody. And you're not going to have all those answers right away. Ask questions, meet people, talk to people, try to get advice, find a mentor. And none of that is easy. It sounds really glamorous. And I talk about this a lot with people where it's like, we'll have people that come in to ask questions. Oh, I want to do this too. It's like, that's great. Like, I'm happy to help. I'm here as one of those resources that I encourage people to go find. But just understand it's going to be very, very, very hard. And it may look awesome. I mean, we've only been open for about 2.5 years. So people look at us and like, oh, I can be just like that in 2.5 years. You're doing really well. We are, it's not to say we aren't, but it's half of that is luck and opportunity and what timelines that I've done and people that I've met. Not everyone has the same opportunities. Some people have better opportunities than me and get more success faster than me. But at the end of the day, as long as you don't quit, it doesn't matter how fast or slow you go, you will get to where you want to get to. For the patient side of things, let me see if I can think of a good one. Advice, tips, tricks. I think that being in my realm in physical therapy and as a strength coach and a fake pitching coach, because that's not my forte, and so I pass those clients off to my better halves at work. I think the biggest thing that we should be focusing on is getting more often of like loading our bodies and stressing our bodies just a little bit at a time and taking that slow and steady approach to just like, I'm just getting a little bit better every day. Growing up, I was always a product or to a fault of like, if it's not perfect, then I'm not doing it. And so that as a younger kid getting into like learning about protein shakes and creatine, I played football in high school, going to the gym. If I left my protein shake at home, I was skipping my workout often. It was just like, oh, it's a waste of time. That could not be further from the truth. I could just go home and have more protein at dinner. But I needed everything to be perfect. And so when that one mess up comes about, you skip it and you kind of have your health take a hit for no reason. I think we should just focus more on the process of it rather than all the extra things. What supplements should I take? Am I seeing the right people? Who's the best trainer? All these different things that don't really matter when we can do a lot just at home and just do a little bit every single day. And as long as you're making it slightly harder, you're going to be in a better place. You're going to have more than likely less aches and pains. Under guidance, it'll be even better because you can have someone who can help you make sure that you're not doing too much or doing things right or whatever. But there's really not too many ways to fail at health. Like, you're going to be fine. You can do a lot of this on your own. And I do tell my clients that, like, you don't need me. I'm happy to help and make this easier for you. But just stay consistent, go for a walk, eventually turn that into a longer walk, start to add in a couple of jogs, right? How do your knees feel? Okay, well, listen to them. Does it bother? Let's dial back a little bit. Like, you can be a very good judge of your health. I think people are just hesitant to, one, if it's not perfect, they'll kind of shift gears and think, oh, an easy way to talk themselves out of it. And two, think that they're maybe going to hurt themselves or do something wrong because they don't have the right guidance. I think we should give ourselves a little bit more credit in terms of how smart we are, how much we do know, how capable and independent we can be. And again, there are a lot of resources out there, and some of them better than others, but you can use most of them are probably okay, good enough to get you going. And you can use your common sense to kind of sift through that, to not have to delay until everything is perfect to get started.
I love that. And I arguably will have to say that both of your pro tips, I think, could swing either way. I think everyone could take, and it's something that we do too here at Meddkit. One of our values and something that we really care about is getting better 1% every day, every week,
Yeah,
whatever that is. And it's just moving that ball forward. And I think everyone could take a piece of your advice, practitioner, athlete, anyone, to just move it forward. And it can be this much, but you moved forward. And I think that's important to take note of for anyone. So I think that's a really positive way to leave off. I'm going to leave it at that
perfect.
because you might dropped it, and I think that was fantastic. But the one thing before we do actually really leave off today, if you could tell folks where they can find you guys, socials, website, things that you're looking forward to in the next coming weeks, months, whatever that might be, that would be fantastic.
Yeah, so the one we use the most is Instagram. So that's bridge.ptp. So bridge, and then the PTP is physical therapy performance. Our website is the same, bridgeptp.com. It's just removing the dot between the bridge and the PTP. So bridgeptp.com. I think our TikTok is the same as our Instagram, bridge.ptp. I'm trying to get into the TikTok world, so I'm not on that one right now. So it's kind of our main like social media stuff. We're on Facebook, but I don't think people gravitate to that too much. We use that more for our ads. Things we have going on. I'm always looking for more room. I feel like we do it really well with the facility we're in. It's almost underwhelming. People show up and they hear all these things about us, and then it's like the small space. But you don't need a lot of space to get started, even for the clinicians out there that are thinking about it. Just do good work. So I think that the big projects we have going on is trying to see like the next step, like where we're going next in terms of facility space, the equipment that we can get to make just our services better for the clients. That database that we're building is going to be really huge. And even now we're delving into like the online world. So after this call, after my 11 client, I'm diving into building out this online platform that we're using, to then see clients and even improve like HEP home exercise programs for our rehab clients, to create pitching programs, strength conditioning stuff, so that they don't have to see us in person. So those are some exciting things that we have going on right now, and it's been a lot of work, but all good stuff.
That's amazing. Well, Victor, this has been awesome. We hope to have you on again, and thanks for spending time with us today.
It was a pleasure. Thanks for having me.